Hi, this is Dr. Janice Tadeo-Portales, and we are going to discuss wellness, diet, and nutrition. The objective of this lecture is to impart knowledge on healthy lifestyle for prevention of obesity, heart disease, hypertension, diabetes, and cancer. The prevalence of overweight and obesity has been rising over the years based on BMI calculation. Based on this graph, there is a continual increase in the incidence of overweight and obesity over the past years. As we continue to gain weight, the higher a risk of developing coronary heart disease, diabetes, hypertension, and gallbladder stones. What could be the reason why we are having more overweight and obese population? Could it be because we overfeed our children? This can be traced from our childhood eating habits. Many of the modern mothers nowadays do not have time to prepare proper meals, thus rely on prepared meals from fast foods. Parents are giving foods to kids as prize for being good or as punishment when parents cannot handle them. Unknowingly, we are the cause of obesity among children. We force feed them. Even if they are not yet hungry, we tend to force them to eat because it is already mealtime. Our perception of a healthy child is a child that is rounded and chubby, and because they are used to eating a lot, their sense of satiety is diminished and would only stop eating when they feel bloated. They acquire the eating habits they develop in their childhood and adopt it till their adolescent stage. Obese children are more likely to become obese in their adulthood. Thin adults can also become obese with the available foods we have these days and with the bad eating habits we develop through the years. We are more attracted to salty, sweet, and fatty foods. Some adults have lost their control in eating that they have accepted being obese. But what are the consequences of being obese? As we grow old and while eating badly, our blood vessels are being filled up by the fat we have eaten throughout the years, until there will become a complete blockage that will cause a heart attack or stroke. Here is another picture of a blood vessel that has been filled with fat. This is the result of years of eating fatty foods. We prevent obesity and having cardiovascular disease with lifestyle interventions such as dietary therapy, physical activity, and weight control. 3 targets for primary prevention in the 3rd Adult Treatment Panel Guidelines of the National Cholesterol Education Program include an atherogenic diet, sedentary lifestyle, and obesity. Primary prevention include therapeutic diet, physical activity on a daily basis, and if needed, weight control. To lower LDL-C or the bad cholesterol, trans fatty acids should be avoided and dietary fiber should be added. Diets high in trans fatty acids can only raise LDL-C but also lower our good cholesterol or our high-density lipoprotein cholesterol. As a result, increased consumption of foods high in trans fatty acids is not encouraged. The following are sources of trans fatty acids. Soft margarines, those in liquid or in tub, are less hydrogenated and relatively lower in trans fatty acids. Consequently, they do not raise blood cholesterol as the saturated fats of butter or the trans fat of hard or stick margarines. These are examples of foods rich in saturated fats. Saturated fats and trans fatty acid rich foods can raise bad cholesterol that can cause atherosclerosis or plaque buildup in our arteries. Health professionals should be aware of the lack of clinical trial evidence of efficacy of megavitamin supplementation. There are dietary options that provide value independent of LDL-C lowering. Increasing omega-3 fatty acids in the diet with fish and or plant sources of omega-3 fatty acids such as canola oil, English walnuts, or flaxseed may be of particular value. These are some sources of omega-6 and omega-3 fatty acids. These are fruits and vegetables that can reduce blood cholesterol. Other dietary options is to add fish, plant sources of omega-3 fatty acids, fruits, and vegetables. There are basic goals for weight loss. A small decrement in weight can improve risk factors for coronary heart disease. A long-term strategy is more difficult and will require regular physical activity to maintain the reduced weight. Many health professionals miss a valuable opportunity in weight management by not emphasizing the goal of preventing further weight gain. This is particularly true in situations such as medication use that promotes weight gain, such as steroids, certain antidepressants or anti-diabetic agents, or injuries such as fractures that cause immobilization, thus preventing energy utilization. A goal of 10% reduction in body weight over 6 months requires a sustained effort. There will be considerable variability in the response of individual patients to weight loss regimens. Formal obesity programs or self-help groups may be of value in reaching these goals. Here are some suggestions of scheduled physical activity and lifestyle physical activity. Each of these activities is equivalent to losing 200 calories. However, we lose 200 calories of fat faster if we move faster, like riding a bicycle, we lose 7 kilocalories per minute. When we swim, we lose 11 kilocalories per minute. When we run, we lose 14 kilocalories per minute. As compared when sitting, we only lose 1.5 kilocalories per minute. And when we walk, 5.5 kilocalories per minute. The metabolic benefits of weight loss are reverse changes of insulin resistance and raising LDL-C or our good cholesterol. The recommendations on how to be physically active to lose weight are as follows. We should maintain a regular physical activity. All individuals should obtain at least 30 minutes of moderate intensity physical activity most days of the week. The activity can be accumulated throughout the day in bouts of 10 minutes or more and does not have to be in the form of structured exercise. For weight loss or maintenance, the amount of recommended daily physical activity is at least 45 minutes per day. A quick way to make sure you are eating a variety of healthful foods at each meal is to rate your plate. Rate your plate is a great way to practice portion control if you are trying to lose weight. This meal is high in nutrients and fiber and low in calories and fat. Rating your plate will give you a good, balanced meal with plenty of nutrients, vitamins, and minerals. In summary, we emphasize the reduction of trans fatty acid, saturated fat, and cholesterol in our diet by reducing intake of animal and high fatty foods, eating fatty fish at least once or twice a week because it is a good source for omega-3 fatty acid, get lower fat foods, especially when eating out, increase intake of soluble fibers such as our fruits, vegetables, and food crops, maintain regular physical activity, and avoiding gaining more weight. So that's it. I hope you learned a lot today. Thank you.